Welcome, this is Health Matters with me, Dishen Kumar, and we are in Puchong. Now, what are we doing here? We are actually talking about making babies. Now, making babies is an interesting topic, but we are going to be talking about IVF, which is in vitro fertilization. Join me, Dishen Kumar, in today's episode. All right, thank you, doctor, for joining us. We have to talk about, or we have to start actually at the beginning. How did Metro IVF actually start, and what is the whole journey? Why did you think that IVF was needed by couples in Malaysia, and did you actually see a potential in Malaysia?
Thank you for inviting me. IVF, what I call the final treatment for infertile couple, is required by about 3% of the female population. Mm-hmm. In other words, 15% of women in their lifetime will seek advice from the doctor on their difficulty in getting pregnant.
Okay.
And of it, you have about 3% who actually will require IVF. Now, before IVF was available, this couple, example with block tube, they have no chance to get pregnant, and they have to live their life with it and accept with it. And of course, they'll find that every time there's a party where there are children, they'll try to avoid. And with these IVF facilities, their life is different. You know? As one couple told me once, say, hey, after they got a child, they say, this year, the new year is different. Nobody asks again why they have not got a child.
So it's a sociological aspect in that, right?
Yes. So actually, IVF, I started IVF about 20 years ago. Yeah. Before then, I was a practicing obstetrician and gynecologist. And after 10 years, I find there is a lot of patients asking for fertility service. And when we give the treatment, which was oral tablets to increase the ovulation, we use IUI, there's still a large group of them who cannot get pregnant. In 1999,
delivered in the year 2000.
Yes, and we delivered in the year 2000.
Okay.
Yeah. And 4 years later, we started to add other facilities of ART. We started to have frozen embryo, and we have our first frozen embryo pregnancy delivered, yeah, in 2004. Yeah.
Great.
And so we see, and lately we also started to have PGS services, where we are able to analyze the embryo, see whether the embryo have any diseases like Down syndrome before even we transfer the embryo into the woman.
Okay.
And this is good for couples where they have a risk of abnormal babies.
Okay. Is there a bit of a stigma on people coming for you for treatment? Do you see that in Malaysians, like before, when they say, because in Malaysia or in Asia in that sense, for a person to say there's something wrong with me is very difficult. Did you find, starting out in 1999, was there a lot of patients who like didn't want to come to you but then they had to, and was there a lot of fear in that sense?
Yes. How they approach us is, they wouldn't tell us exactly that they actually want a child, you know, because they cannot get. They'll say, oh, my period not regular. Hey, doctor, can you check? Is there anything wrong or not? Why is it the period sometimes miss, and but yet I don't get my what I want. You know? So in other words, a lot of them do not come forward. And at that time, most of the time, the people approach us was the woman. Yeah, they'll come and ask. And when they open up the subject of infertility, we investigated, and the husband still won't appear. Only after some few cycles, we say, hey, your husband will come for checkup. And then only they found that they have no choice, the husband comes. But I think today is different. We are seeing even men coming forward and check first, before the wife comes forward.
Now, IVF, a very interesting process. Doctor, could you actually describe to us what is the whole process of IVF? For a couple who comes to you and says, I want to do this treatment, and what do they actually go through?
Yeah, we explain to them the whole process of IVF consists of about 5 stages.
Okay.
Yeah, the first stage is we will give them injection, total about 9 injections, certain day 2 injections at one time, where we will want to have about 5 to 15 eggs developed so that we can harvest that number. And this first, we call it the ovarian stimulation phase.
Okay.
So it will last about the first 14 days of the cycle. The second phase is to extract the egg. There we use a fine needle through the vagina. We take out the egg one by one, and straight away we pass to the embryologist beside. And the third stage is done by the embryologist, nothing to do with us, the clinician. The embryologist will fertilize the egg with the sperm provided by the husband. And then fourth stage is we will transfer the embryo into the womb, and so that it's in the best place for implantation. And the last phase is about 14 days, where we wait for the embryo to stick on to the endometrium or the uterine lining. And then pregnancy will be confirmed with the blood test after 14 days.
Okay. Now, doctor, if a couple comes to you for IVF, we have to talk about how much it's going to cost. So, what is the price range currently for IVF treatment in Malaysia?
The whole cycle of IVF, from the beginning until they get pregnant, in Malaysia, the price can range between 15,000 to about 25,000. And of course, if we are doing other extras for this IVF, example PGS, well,
what about couples who can't afford? The couples who have problems and can't afford, is there any collaborations currently with any government facility or government hospitals?
Yes. You see, in the year 2008, we were approached by Ishtar, there's a hospital besar Klang, to provide collaborative services. You see, they suggested they have a lot of patients actually who seek fertility treatment. They'll treat them on the stimulation, and only when it comes to the egg pickup, culture, fertilization, and transfer, they will come to us for that procedure. And after that, they go back to the Klang hospital and manage until pregnancy. So in such a situation, actually the patient save costs ranging to about paying to about 50 to about 60% of the actual cost.
Okay.
And this collaboration actually help people who marginally can afford IVF. And we actually, the first baby was from the collaboration was in the year 2009. It was a couple delivered 2 girls, twins.
Twins.
Yeah.
Okay. So the whole duration of the IVF takes how long?
It's about 4 weeks.
4 weeks.
Yes.
Okay. And what are certain factors that actually can affect a couple to have successful treatment? What are the things that plays a part for a successful treatment?
Okay, the success of an IVF is now 100%. Yeah, and it varies. Yeah. First, we look at the patient itself. Yeah. If the patient's age is very young, example 28 years of age, then we can quite confidently say that she has a good chance of getting pregnant. Okay. Probably about 60% over. Whereas a woman at the end of her reproductive life, example 40 years and above, her chance is very low. You sometimes can go out to work 10-20%. So age is a very good factor. Second is, I think the motivation and the what the patient does during the time when they are doing the IVF. So if the patient are more motivated, positive thinking, and they also motivate the lifestyle, then they also can have a high chance of getting pregnant. Then on the part of the lab, well, of course the lab, they are more well equipped, they have run many cycles a year, and they have many years of experience, and the embryologists are experienced, then of course the result is different.
And talking about that, lifestyle changes, what type of lifestyle changes does one need to do? Let's say if they're going for this treatment, both men and women, the couple need to go through to get a successful treatment.
Okay, woman, let's say they want to go for this IVF, a month or 2 before that, it's good they have I say the word, more fertile diet. Yeah, they should avoid diet that has high glucose level, that means high carbohydrate level. Because if they have high carbohydrate level like rice, meat, kway teow, then it will affect the glucose insulin metabolism. Yeah, it's not so good for the egg production. In fact, they should take more vegetables, fruits. Yeah, that will be better.
Have a healthier diet in that sense.
Yes, yeah, and at that time, they should not have fluctuation of their weight, so that you do not disturb the hormonal balance. Yeah. And for the food, protein food, they should take more food like it's less oily, fish lah, chicken lah, egg white lah. These are better food than to take a lot of oily food. It's not so good.
Now, IVF is a very, very positive treatment. It gives couples who can't have kids actually a chance to have children. But with every procedure or every treatment, there are side effects. So, doctor, could you actually go through with us the risks or side effects of IVF?
Okay, the risk of IVF, let's say we go back 20 years ago.
Okay.
Yeah, IVF was new. Yeah. So we are using a lot of drugs, and some of the drugs will cause ovarian hyperstimulation syndrome.
Okay.
Where the ovary get overstimulated and they produce too many eggs. And when they produce too many eggs, they also have a lot of water accumulated in the body in the third space. Basically what happens is the whole body is bloated with water. So that is quite risky to them. And mild cases are quite common. It can be well treated. Moderate cases can be easily treated. It's only the severe cases. And of course, with the new medication that's available now, it hardly occurs now.
Okay.
And the other side effect that we have in IVF is multiple pregnancy. So if you were to transfer 4, 5, 6 embryo, then you may have a risk of triplets, quadruplets now. But it is not practice now to transfer that number. The standard practice is now to transfer 1, 2. And if the patient have a recurrence or failure, sometimes we have transfer 3. Otherwise, the risk of this multiple pregnancy, like triplets, quadruplets, hardly occur now. The most is twins. Yeah.
Right, we have to talk about your oldest patient in Metro IVF. The oldest person to go through IVF procedure using their own weight. How old was your patient?
Oh, this lady we had was 46 years old. Yeah. It's actually the oldest woman who delivered through IVF, yeah, using her own egg. Yeah, it was the year 2013. Actually, she was actually managed in a hospital in UK. She was working there for 20 years, and then she was looking for a place to do IVF, and it was during, I think, around Christmas time when she took a holiday, and she came and did IVF with us. Yeah, and that lady, we only managed to obtain 1 embryo. Yeah, and 2 days later there was 4 cells. The journey was, first of all, we told her she has 4 follicles, and she was so happy. So when we harvested, we have 4 eggs. And when we fertilize, you have only 1 embryo. So there's an up and down, you know. And she looked a bit down. So we transfer for her, yeah. And then 2 days later, she said, okay, thank you. She go off, you know. So anyway, she was a very positive woman. She planned everything. And 2 weeks later, she texted us and said she's pregnant. And she took 1 year leave from her work. She said, I will never have get this chance again.
Yeah, that's true.
And she delivered a baby, and it was a baby girl. We're happy for her.
All right, doctor. I think final question: your advice as a medical professional to couples who actually want to conceive or want to have children but have been trying for some time. What should they do?
Okay, if you are still in the age of 35 and below, try. Yeah, do time in the course. Always remember, if you do on the first 1 week, it will not have an effect. Yeah. In the middle, day 12 to day 15, have sexual intercourse. If you are trying for 1 year, you still cannot get in, seek your doctor treatment early. Yeah? And then the doctor assess, most of the time, 90% of the time, you'll find that there is some factor in either the husband or the woman that make them cannot get pregnant. You get treated, you should get pregnant. Only a third of this couple really need to do ART to achieve pregnancy. So, see your doctor early.
All right. Thank you, doctor, so much for your time.
Oh, thank you very much.
Welcome, we are back. This is Health Matters with me, Dishen Kumar. And in the previous blog, we actually talked to Dr. T about Metro IVF and how IVF started and the whole process of that. But putting that all aside, we have to talk to a patient or to the person that actually went through the experience. And we have her today, and we will share all her personal journey and her personal experiences. Okay, thank you for joining us today. Could we start off with you introducing yourself?
My name is Yong Kwan. I'm 45 years old. I'm a finance manager.
All right. And how long have you been married before you started thinking about having a family?
For 5 years, I'm married for 5 years when I reached 40 years old.
So you got married at 35, and then at 40 years old, you decided that you wanted to start a family.
Yes.
Okay. And how long were you trying to conceive before your first visit to the doctor?
Should be 5 years because already married for 5 years before I make a first step to visit a fertility doctor.
So did you ever feel pressure to, because we all know in Malaysia, when a couple gets married, the first thing the family says that, oh, you have to have a child, or you have to give me grandchildren and things like that. So did you feel any pressure from your family to conceive?
Not at all, because I have my own thinking. That means external factor will not influence me to make my decision.
Okay. And how did you actually get to know about Metro IVF?
In actual fact, I don't know anything about Metro IVF.
Okay.
I just know about Dr. T, the best fertility doctor at Metro IVF.
Okay. And I think the most important thing for you was that you actually decided that you wanted to start a family. And I think you decided at the age of 40.
40 years old.
Yeah, okay.
Yeah.
But, and maybe talking about that, how did your family take it when you decided, I want to go and do IVF? How was your husband in taking that? Was everyone supportive around you?
Definitely they are supportive because when you reach the age of 40 years old, actually you don't have any more choice left other than doing IVF because the age is catching up, then to conceive is very difficult.
Yeah, okay. After the treatment, you went for the treatment, IVF treatment.
Yes.
And did you have to wait for a period of time before conceiving, or was it confirmed almost immediately?
With positive mindset and a good fertility doctor, I able to conceive immediately when I received the first IVF treatment.
Oh wow, okay. And can we talk about the duration? How long did it actually take for you? From the start of when you first saw Dr. P and for when you got conceived, how long was the whole duration of the process?
Actually, I able to conceive within 1 month when I first visit Dr. T.
1 month, yeah.
Yeah, because during that time, I still remember the first time I go and met Dr. T. So I asked Dr. T which one is have a highest success rate.
Yeah.
So Dr. T told me that actually IVF is a higher success rate. So without thinking much, I straight away decided to do IVF. So once I decided, then depend on my menstrual cycle, then straight away within 1 month, I already go for this IVF.
And tell me about how do you actually feel when you had twins, a boy and a girl? How do you actually feel when you finally had them? You went through the whole experience, you went through IVF, you delivered them. What was the feeling that you actually had?
Okay, actually for this IVF whole process, right? The good thing is at the beginning, I do not know anything about IVF. So I just follow the flow and procedure to do it. The most important, you need to trust the doctor. So all your stress and all your burden, you just pass to the doctor. Anything, you just ask the doctor. So the doctor will able to resolve for you. So I didn't, actually I didn't feel any stress at all during my whole journey of pregnancy.
Okay. And when the kids were born, how was it?
The feeling like you get a lottery, a billion lottery, this kind of feeling. So it's difficult to express how happy was it, yeah.
I think it's a very, very...
yeah, like you get the lottery, you're really, really
yeah,
happy,
very happy
yeah.
Okay, and what if IVF didn't work? What would have happened?
if let's say IVF didn't work, maybe I will keep on trying for a few more times.
Okay.
Few more times until it is successful.
But if that also like, if you can't conceive, what would you have gone to? If you didn't find IVF and you couldn't have children, what would you have gone to? What was the feeling that you would have had?
The loneliness. Because when I reached 40 years old, actually the loneliness will strike in. Especially have a gathering with your ex-classmate, and also ex-colleagues.
Yeah.
Because you feel that they are very happy because they have a full family together. So let's say myself, the loneliness will feel very lonely because only me and my husband. Yeah. So these are things.
And I think motherhood also is actually very important for a female person to go through motherhood is actually a very important process, right?
The feeling of become mother and the pregnancy journey actually is a very happy journey. So not everybody able to experience this kind of journey. So it's a very blessing and grateful to have to experience this journey. Yeah.
All right. And how was your experience dealing with Dr. T? Dr. T was your doctor.
Yeah.
How was it for you? Like, of all the positive things you can talk about him, what's the few things that you can say?
Dr. D is really a very good doctor, a very patient and very caring doctor. So I think her objective is very clear. His objective only want the patient to success. So any issue we just talk to Dr. D, then definitely he will give us a solution, the best solution. Yeah.
Okay, you actually went for IVF and the treatment, but talking about all of that, what about the cost?
Yeah. So for myself, right, I'm a very result oriented and also time and cost conscious person. So I first time I visit Dr. D, I asked Dr. D the question that which treatment can give me the highest success rate. So Dr. D told me that time is IVF actually can able to give you the highest success rate is more than 80% was a success rate. So without thinking much, that's why I chose IVF as my medical solution.
And it worked, definitely.
Yeah, it worked. Yeah, it's because it's a success.
So I think it's based on the patient's decision which treatment they want to go for. But IVF has the highest success rate, and it has worked for you.
Yeah, that's right.
Maybe we can talk about your advice for couples who are trying to conceive. What would your advice be?
Okay, for those couple that are below 35 years old, already try to conceive naturally for 2 years, and for those couple more than 35 years old, already try to conceive naturally for more than 1 year, you should make a first step to visit the fertility doctor. Don't have the misconception thinking that going for the fertility doctor is for IVF and IUI. Actually, it's wrong thinking. Go for a fertility doctor, you will get their best advice for the best method treatment to treat your condition. Maybe they can advise for you to naturally to conceive. Don't wait until the age of 40 years old, because once you reach the age of 40 years old, actually you don't have any choice left to choose. Yeah, this is my advice to the couples.
I think it's important that couples nowadays know that it's okay if you can't conceive. It's okay to come for help.
Yeah.
And we have all this IVF. I think it's very important, and we really like your story. You have a very nice story. Just another thing, like talking about your kids nowadays. Do you think of having more children?
Two is enough. Two is perfect. In Mandarin, right? Two is 1 boy 1 girl is considered very good. It's a good character. That means in the Chinese character is a good how.
Okay.
Yeah.
Okay. All right. Thank you so much for your time.
Yeah. Thank you.
Alright, this has been Health Matters with me, Dishen Kumar, and today's topic was IVF. We talked to Dr. T and Madam Yong to get their different perspectives from the medical point of view and also the personal point of view. Now, in conclusion, what can be said is that if you are a couple trying to conceive and trying to have a child and have not been able to do it, it's okay to ask for help. So please look into IVF and all the other assisted reproductive technologies. Join me in the next episode as we discuss even more topics on health, and because that's what's important, your health matters. My name is Dishen Kumar. Thank you. Good night.